it's really a clinical, it really is a clinical diagnosis, and so, you just have to recognize that there is some inflammatory component to the disease. Sometimes it can be very subtle. The classic one that we learn about in ophthalmology residency is Posner-Schlossman. That can have very, very mild inflammation, and they can present with really high pressures initially. So recognizing that that's something that can respond to steroids and can clear up quite quickly. Patient presents with a pressure of 50 or 60, but it's a relatively benign condition that can be treated easily with mild steroid treatment. So recognize that's important, even though it's very, very subtle to pick up, initially. So you really have to look carefully for those subtle signs of inflammation, try to recognize that, and then once, you have that patient, then recognizing the recurrences, trying to eliminate those recurrences and so forth is important too, and that involves the diagnostic skill as well, in the sense that you have to, when they do come in, you have to be looking out for the levels of cell and flare, and if they do have a little bit there but they're not symptomatic yet, do make every effort to try to suppress that. So the chronic long-term care is almost as important for those kind of assessment and diagnostic skills as the initial evaluation. So yeah, it's something that you have to really look, and the key thing there is look under high power for the cell and flare. Look and look for the other aspect about it is look for the other things that may give you some clues as to the underlying etiology. It always helps to know the underlying etiology for the inflammation. If you know that somebody has Fuchs heterochromic urticaria, that can provide you great insight into what's going to happen to that person over time and what they're going to respond to and what they're not. And you also, with certain diseases, obviously if it's an infectious disease, let's say syphilis, if you know that if you diagnose syphilis, then you can treat that with antibiotics, and once you treat the underlying etiology, the uveitis goes away. So I think we'll have new things, Ebola and Zika and all other things that are causing inflammatory diseases that we'll have to deal with. But so recognizing those underlying etiologies is really important too. So you're also looking for things that may give you some clues about that. But specifically to try to recognize things that are treatable. Herpetic keratouveitis, another very important one that we want to pick up, because to look for the signs that might go along with that, because we want to pick that up because, again, antiviral therapy can be very, very helpful for essential and helpful for those patients. So yeah, I think the diagnostic part of it is really important for not only the initial evaluation, help you figure out the etiology of the uveitis, hopefully, and also help you to manage the patients long term. Both are important.